Gynecologist, what's the worst thing you've ever seen? Enjoy your meal.
Gynecologist on the line. Sometimes I come across unpleasant cases when a girl walks around with one tampon for days and weeks. Necrotic cancer in the vagina also looks so. But this is not even close to the worst case in my life. Once a 19-year-old girl came to our clinic and complained that her vagina was stuck with a hairspray cap. Well, it's not a problem, I thought naively. But the catch was that she put it in there at 15 years old. That is, 4 years old. She didn't explain to us the motivation of this action, but it was clear that she was very ashamed. Even before she undressed, you could feel just a terrible smell, which became even worse when I went to study the problem. The lid was stuck with the edge up, and it was clear that in 4 years she had grown well with vaginal tissues. The difficulty of the treatment was exacerbated by the fact that this cover pierced her urethral bubble and the rectum. To get it out, she had to do several extensive operations. I'm not a gynecologist, but I know someone who recently had a hysterectomy, an amputation of the uterus. In general, the girl had stitches in the vagina that needed to be given to heal, but she was so impatient to return to the uterus. But she was so eager to return to her sexual life that she couldn't hold back and ended up tearing herself, as a result of which a thin intestine fell out of her vagina. I was told in such detail that I think I will never be able to eat minced meat again. According to the girl herself, when she was on her way to emergency surgery, she could feel the intestine resting on her leg and pulsating.
In high school, I had a friend who was very afraid of going to the gynecologist. When she finally decided to go for her first smear test, she got so nervous that she clamped the doctor between her legs like a vice. According to her, it took some time before she could relax and release the doctor, and it was extremely awkward. Now, of course, she laughs about the situation, but her shyness regarding her female organs hasn't gone away. She still doesn't like using tampons.
I'm a medical student, and once I volunteered to assist in a hysterectomy. When we were going into the surgery, we were told there was a small ovarian tumor, but it turned out to be much worse. The patient's internal organs were covered in metastases, and we spent 13 hours just reducing their volume, even though the entire operation was supposed to take about 3 hours. At some stages, we had help from the general and vascular surgery teams. We replaced half of the patient's blood volume. After all that, she felt very unwell and had a long and difficult post-operative period, but eventually she pulled through and returned home to her family. It was an exhausting case for all of us, but the patient and her family were such wonderful people that it was an honor to help them.
I'm a medical student, and in a few weeks, I'll be a fully fledged doctor, though not exactly a gynecologist. During my gynecology rotation, I was sent to examine a woman, and as I was preparing, the smell in the room made me think I was about to encounter the worst bacterial vaginosis I'd ever seen. I started the examination, carefully checking everything, but found no unusual discharge. It was strange. As I began to move back, I noticed that the further I moved away, the stronger the smell got. It turned out she just had incredibly smelly feet. I highly recommend reading Dr. Lissa Rankin's book, What's Up Down There, where she writes about some of the most horrifying cases in her career, like finding maggots in patients and other shocking stories. But those are just the tip of the iceberg. The most insane case was about a woman who had a potato growing inside her.
I'm not a gynecologist, but I sometimes perform examinations, and once I removed a tampon that had been inside for at least a month. The most interesting part is that the girl had been sexually active all this time. The smell was absolutely horrendous, and after she left, it took several hours to air out the room. We spent that time wandering around the clinic, trying not to throw up. So basically, a woman decided to use a potato as a contraceptive. Since potatoes thrive in warm, dark, and moist environments, it started growing, and eventually, potato sprouts were hanging out of her vagina.
I have a story that's not about vaginas, but it's equally revolting. When I was in high school, I joined a student organization that sent students out for practical experience. I decided to volunteer at an emergency room. One day, they brought in a very overweight woman complaining of chest pain. Everyone could smell an awful odor coming from her, so the doctor decided she needed a good wash before the examination. As he was washing her, he lifted one of her breasts, and the smell that came out was so bad that we almost passed out. Underneath her breast, there was a discolored patch of skin. The doctor washed it, and as the crust peeled away, it revealed a small hole from which cockroaches started crawling out. Apparently, eggs had been laid in the folds of her skin, and when they hatched, the roaches couldn't find a way out, so they had to chew their way to freedom. My mum has a story that I think is the most disgusting hospital tale I've ever heard. Once, a 50-year-old patient, extremely obese at 227 kilograms, came in and mentioned that her husband had complained about a strange smell during their intimate moments. The thing is, it wasn't just her husband who noticed the smell, everyone in the hospital could smell it too. I don't remember all the details, but it turned out that her entire vagina was necrotic. She needed surgery, but it didn't save her, and she eventually passed away. The best or worst part of the story is that her husband was the first to notice that horrific smell, and it happened during sex. I'm not a gynecologist, but I've seen my share of gruesome cases. First, I saw a woman with vaginal cancer, and then I saw what was left after the complete removal of her vagina and cervix. It was an unsettling sight, and I can't describe all the procedures because I was a very young student at the time, but in the end, all that remained was a large, open cavity from which something was dripping. The poor woman was so devastated that she begged her husband to leave her, saying, "After this, you'll never be able to love me." But he was a hero, staying by her side, holding her hand, comforting her, and showing her love. It was clear he truly adored her. Second, we had a 220-kilogram woman with paralysis of the lower limbs. She had a massive ulcer and necrotizing fasciitis that had destroyed everything in her genital and buttock area. The rectum had erosions, which we realized because feces were leaking from several damaged areas. When the doctors asked for a urine sample, it turned out she didn't have a bladder anymore. The vagina was also gone, so we tried to manage as best as we could. We had to carefully turn her onto her side and stuff a bunch of gauze into the enormous cavity, hoping she wouldn't have an accident during the procedure. She passed away very quickly. In such cases, we're powerless.
I'm not a gynecologist, but I've had a congenital defect that I didn't pay attention to until I started using tampons. It turned out that I had a septum, so instead of having one opening, I had two. I only realized I had a problem when I once unsuccessfully tried to remove a tampon. I inserted it through one opening and then tried to pull it out through the other, smaller one, and it got stuck. It was excruciatingly painful, but I couldn't do anything about it. Luckily, my mom was nearby. At first, she thought I was just a fool who couldn't get the tampon out, but then she saw what was really going on and took me to a gynecologist. I had surgery, and now I don't have any problems.
I'm not a gynecologist, but while working in the emergency room, I saw an interesting case. An elderly woman was brought in after a fall. We did an X-ray, and it showed a gigantic vaginal cancer that looked like 2/3 of a football had been attached to it. The tumor was so large that it was pressing on the nerves in her left leg and obstructing blood flow, which is why she fell in the first place.
Do you know what happened to her afterward?
When I left, they were still working on her case. I hoped that eventually she was moved to hospice care. With such a tumor and at 80 years old, there would be no point in continuing with chemotherapy, radiation, or surgery.
A couple of years ago, my buddy was a gynecology intern. One day, a young patient came in with two complaints. One, she couldn't get pregnant, and two, she had constant diarrhea. The gynecologist asked how often she had anal sex, and she replied, "Always." It turned out her boyfriend had convinced her that getting pregnant through the back was easier than through the front. So she had asked him to only have sex with her this way.
My mom works as a gynecologist assistant, so I've heard quite a few stories. One day, a woman came into the office smelling like a garbage dump. It turned out she had been wearing the same underwear for about 2 months. They were dark brown, and apparently, no one had told her that she actually needed to wipe her bottom.
Thank you very much for watching. Gynecologists, feel free to share in the comments what the most horrifying thing you've ever seen is. Don't forget to check out our other videos, and by the way, enjoy your meal. Bye.